mynews.studio.
A single bacterium responsible for a centuries-old threat is nearly under control now. But how did international collaboration help bring trachoma cases below 100 million?
Today is February 2nd, 2026. Let's dive in. For the first time since records began, fewer than 100 million people need interventions for trachoma. That's a 94% reduction since 2002. So, what exactly changed over these years?
Trachoma is caused by Chlamydia trachomatis. It's actually the leading infectious cause of blindness worldwide. It spreads through contact with infected eye secretions. Even now, about 1.9 million people are blind or visually impaired because of it. But 2 decades ago, over 1 billion people were at risk.
This kind of turnaround isn't accidental. The core was the safe strategy: surgery, antibiotics, facial cleanliness, and environmental improvements. Let's break that down a bit. Surgery targets trichiasis, which is the stage where eyelashes turn inward and scratch the eye. Antibiotics, azithromycin mainly, were distributed in mass campaigns. Pfizer provided huge amounts through the International Trachoma Initiative.
And the other two, facial cleanliness and environmental improvements, are about community education and better infrastructure. That means teaching people about hygiene and building access to clean water and sanitation. In 2024 alone, nearly 87,350 people got eye surgery, and over 44 million received antibiotics in areas at risk.
Those numbers are huge. Since 2012, mapping teams have examined more than 13 million people in 55 countries. That's one person every 25 seconds if you average it out. Why does this matter so much? Well, with accurate data, health workers can target their efforts to the places that need help the most.
And that's the key to the 94% reduction. Layered interventions applied consistently and all based on data. Each part, surgery, antibiotics, hygiene, sanitation, interrupts the disease in a different way. If you leave one out, progress stalls. Keep all 4, and you see these dramatic drops.
Let's look at the countries that have officially eliminated trachoma as a public health problem. WHO has validated 27 so far: Benin, Cambodia, China, Ghana, India, and others. Egypt and Fiji joined just last year. Egypt is a milestone because it's now the 7th country in the Eastern Mediterranean to get there. They included trachoma surveillance in their national health reporting.
Fiji stands out too. It's the first time that any neglected tropical disease has been eliminated in the Pacific region. They focused on school health programs, improving water and sanitation, and running community awareness campaigns. So even island nations with limited resources can achieve this, with the right mix of strategies.
But we can't relax yet. Nearly 100 million people remain at risk. Most live in remote areas with little access to clean water or health services. And there's a funding gap, about $300 million still needed to hit the 2030 elimination goal.
The challenge is concentrated in Africa now. 32 countries, mainly in eastern sub-Saharan Africa, still need interventions. Political instability, fragile health systems, and lack of sanitation slow things down. And without enough funding, these efforts lose momentum. Why is that important? Every dollar invested now saves much more later. Pfizer alone has given $2.2 billion worth of medicines.
There's another aspect here. Women are more affected than men. More than half the people getting antibiotics are women, likely because they're often primary caregivers. Addressing that imbalance is crucial for full elimination.
This campaign against trachoma also connects to broader global health goals. It's part of Sustainable Development Goal 3.3, which is about ending epidemics of neglected tropical diseases. Right now, 58 countries have eliminated at least one NTD. The target is 100 by 2030.
So, what do we take away from all this? First, interventions need to be data-driven. Second, funding must be steady. Third, partnerships, governments, donors, pharmaceutical companies, and communities working together. And finally, the importance of involving local communities and cross-sector collaboration.
These aren't just lessons for trachoma. They're a model for fighting other neglected tropical diseases too. Multi-sector approaches, community monitoring, and wise investments can make a difference for diseases affecting over 1 billion people.
Let's recap. The number of people at risk for trachoma dropped from 1.5 billion to 97 million in just a bit over 20 years. A safe strategy, detailed mapping, and coordinated action drove this change. But to finish the job, we still need that extra $300 million and commitment to the effort.
If that happens, trachoma could become history by 2030. That means preventing avoidable blindness for millions more. And it makes you wonder what else could be possible if we use this model elsewhere.
Thanks for joining us. This episode was brought to you by mynews.studio. Try it out for free.